हेलो अस्सलाम वालेकुम, वेलकम टू अनदर एपिसोड ऑफ नुक्ता स्पॉटलाइट। आज एक बहुत ख़ास दिन है। टुडे पाकिस्तान हैज़ completed 79 years of independence. इंडिपेंडेंस डे के अराउंड जो कॉन्वर्जेशंस होती हैं वो मोस्टली इकोनॉमिक ग्रोथ की होती हैं, बट they're not about building a healthier nation, and which is so important. इसीलिए today in the Nukta studios we have someone who talks about this, who talks about self-care, who talks about building Pakistan into a healthier nation. He is the CEO of Haleon. Haleon वो कंपनी है जो आपके बहुत ट्रस्टेड ब्रांड्स बनाती है, लाइक पैनाडोल, कैक, इनो एंड मैनी मोर। जब से कवि नसीर ने ये रोल लिया है एट Haleon, उनका सिर्फ एक ही मकसद है, टू मेक पाकिस्तान हेल्दियर, to expand local manufacturing, grow exports and strengthen Haleon's long-term commitment to Pakistan. और आज हम उनसे इसी बारे में बात करेंगे। अस्सलाम वालेकुम, क्या हाल है? Thank you so much for coming in.
वालेकुम सलाम, thank you so much for having me.
79 years of Pakistan. अब कुछ बदलेगा?
Well, hopefully चीज़ें बदलेंगी, कुछ चीज़ें बदली भी हैं, and I think Pakistan has seen a lot of progress in the last 79 years. If I just talk about the health sector, I think we're at the cusp of really changing things around for the future. The right conversations are happening in the ministries and the governments of what's the future of healthcare for Pakistan. But I think it's about pinning down कि exactly हमें करना क्या है. मगर I think what we really need to change, what hasn't changed in 79 years, is we need to change ourselves. हम बहुत रिलायंट हैं कि हमारी गवर्नमेंट आगे कुछ करेगी। सबसे बड़ी चीज़ ये है कि हम अपने लिए ख़ुद क्या करते हैं डेली, एंड दैट इज़ व्हाट सेल्फ केयर इज़ ऑल अबाउट। अगर हम अपने लिए ख़ुद कुछ करना शुरू कर दें तो चीज़ें बेहतर हो जाएंगी। अनफॉर्चुनेटली एज अ नेशन, सॉरी टू से, मगर हम रिएक्टिव हैं, प्रोएक्टिव नहीं हैं। हम सीट बेल्ट तब पहनते हैं जब 10,000 का चालान लगता है। अब हेलमेट तब पहनते हैं जब हमें एक्सीडेंट हो जाता है।
ऐसे ही
हम अपनी हेल्थ के बारे में ख्याल नहीं रखते। मैं हमेशा ये कहता हूँ कि हमारी जो बॉडी है वो सबसे अच्छी आपको रिस्पॉन्स देती है कि यार क्या चीज़ सही चल रही है, क्या गलत चल रही है, एंड उसको हम नहीं सुनते, हम उसका ख्याल नहीं रखते। अगर आप जवानी में इन द एजेस ऑफ 10s to early 20s 30s नहीं ख्याल रखेंगे तो बुढ़ापे में वो बॉडी सस्टेन नहीं कर पाएगी। इसलिए आप देखें हमारी एवरेज एज जो है वो अर्ली 60s में, विच इज़ वेरी अनफॉर्चुनेट।
क्या करें, क्या चेंज करें? लाइफस्टाइल, माइंडसेट?
देखिए, सबसे बेसिक जो चीज़ है, मैं हमेशा कहता हूँ, फ्रॉम अ गवर्नमेंट लेवल एजुकेशन चेंज करें। हमारी एजुकेशन में लोगों को बताना बहुत ज़रूरी है कि सेल्फ केयर क्या होती है, हाइजीन क्या है, ओरल हाइजीन क्या है, हाथ कैसे धोने हैं। सबसे बड़ी चीज़ जो हमारी जो सबसे बड़ी प्रॉब्लम है वो है पानी। पीने का पानी, पीने का साफ़ पानी अभी भी लोग उबाले बगैर पानी पीते हैं। अब नहीं, वो ज़माने चले गए जहाँ पानी जो है आप नल से पी लें। सो वो बेसिक्स करनी है, और अगर आपको अपनी पेन मैनेजमेंट करनी है तो वो क्या है? हमारा जो हेल्थ केयर सिस्टम है ना, इज़ अंडर अ लॉट ऑफ प्रेशर। वी हैव एक डॉक्टर है 1000 लोगों के लिए। देयर इज़ नो वे दैट यू गोना गेट क्वालिटी हेल्थ केयर इन द कंट्री लाइक पाकिस्तान एट द मोमेंट। सो व्हाट यू नीड टू डू इज़ लीड अ हेल्थियर लाइफस्टाइल, ताकि आप सेल्फ केयर से move away from sick care. We don't have the hospitals, we don't have the doctors, we don't have the system for it.
Yeah.
So we need to take care of ourselves. And taking care, I was on another show the other day, and I was telling the host, taking care of yourself costs less than the cost of chai for a day.
Yeah.
Which is what people don't understand.
Yeah. So you don't sell water. You run a pharma company, Pharma companies के बारे में तो ये मशहूर है that they want to sell their medicines, which is obviously fair. That's their product. But today here you're not talking about you're talking about prevention, which means कि आपकी दवा कम बिकेगी अगर पहले से प्रिवेंट हो जाएगा और वो साफ पानी पिएगा और अच्छा खाना खाएगा. And that's very heartening to hear, to be very honest.
Again, before I'm the CEO of a pharma company, I'm a Pakistani. So it's my duty to talk about what's right for Pakistan.
Yeah.
And as a pharma company, we have products which will help you in every avenue of life.
Yeah.
So we will continue to grow if we have a healthier Pakistan also. And we will even do better as a pharma company if we have a healthier Pakistan because of our portfolio that we have. So I think the conversation needs to happen on the right track. It doesn't need to be on profits. It needs to be on what's right for the country.
Definitely. You sell a product that I think is Pakistan's most favorite product, Panadol.
बिल्कुल है, and we sell a lot of Panadol, and fortunately or unfortunately, Panadol is the solution for a lot of people. अगर आप लोगों का हालात देखें तो 40% of the people are below poverty line. उस गरीब आदमी के लिए अपनी पेन मैनेजमेंट के लिए Panadol जो 1.3 रुपए की गोली है is the easiest way to manage his pain. And that is why Panadol is one of the favorite medicine, and it's a trusted name.
Yes.
The science behind it, the technology behind it is global, and I can vouch for this that the quality we get in Pakistan is the same quality we get in Europe and US. So there is no difference in quality of product. It's the same product, it's the same quality.
अच्छा. That's interesting to hear.
Yeah.
And 2 Panadol लेनी चाहिए.
लेनी 2 पैनाडोल चाहिए. देखें पैनाडोल हमेशा जो होती है वो वेट के लिहाज से होती है. ये लोगों को ऐसा रियलाइज़ नहीं होता. सो हमेशा अगर आप बच्चों की देखें तो बच्चों की डोजेज लिखी होती है बाय वेट, डॉक्टर कैलकुलेट करके आपको बोलता है. अडल्ट्स में लोग समझते हैं एक पैनाडोल काफ़ी हो कि यूजुअली एन अडल्ट मेल और अडल्ट फीमेल के लिए 2 पैनाडोल चाहिए होती है. अगर आप एक एवरेज अडल्ट से भी भारी हैं तो शायद आपको ज़्यादा पैनाडोल चाहिए हो डिपेंडिंग ऑन योर वेट. बट 2 पैनाडोल इज़ द बेस्ट वे to go about it. A lot of people take 1 Panadols. That's not sufficient. दूसरी चीज़ safety profile में Panadol is one of the safest medicines in the medicine world. The fact that pregnancy में paracetamol or Panadol is the only medicine that is allowed for the female. Even when a newborn, paracetamol is the only product that is allowed. It tells you about the efficacy of the product.
Misinformation तो आजकल हर जगह ही है because of social media. I think everyone is a doctor, everyone is an expert anywhere, right? And self-prescription, self-prescribing of medicines बहुत ज़्यादा हो रहा है, right? So, but I want to understand from you, for these OTC medicines, the ones that Haleon mainly sells, should you be going to the doctor or is it okay to self-prescribe?
देखिए हमें ना differentiate करना पड़ेगा between self-medication and self-care. सेल्फ मेडिकेशन इज़ रॉन्ग. सेल्फ मेडिकेशन इज़ जब आप एंटीबायोटिक्स जो हैं ओवर द काउंटर लेना शुरू कर दें, आप कोई और दवाइयाँ ओवर द काउंटर लेना कर दें. सेल्फ केयर इज़ बेसिक लेवल ऑफ मैनेजमेंट, लेवल 1 मैनेजमेंट बिफोर यू गो टू अ हेल्थ केयर प्रोफेशनल. सो यू वेक अप and you have a pain in your leg.
Yeah.
Right? So you will not go to an HCP and you will not go and buy an antibiotic. What is this first level? First level is that you'll try to see कि अगर मैं Voltron लगा लूँ, मैं Panadol की 2 tablets खा लूँ, does it get better? If it gets better, you know that it was probably because of something that, you work out or anything like that. But if it doesn't get better and if it gets extremely worse, then you will go to an HCP and you will go to a pharmacist or an HCP and ask, what can I do? So I always say this, always consult your healthcare professional, right? Never self-medicate, but टियर 1 लेवल पे सेल्फ केयर आप खुद कर सकते हैं. सो अगर आपको पता है कि आप में कैल्शियम डेफिशिएंसी है तो CAC और कैक को आप खा सकते हैं, राइट? एंड यू कैन टेक दैट. बट इट इज़ ऑलवेज गुड अगर आपने लॉन्ग टर्म कोई भी प्रोडक्ट यूज़ करना है तो आप डॉक्टर से पूछें. बट जो दूसरा चैलेंज है सबसे बड़ा वो ये है कि हमारे यहाँ लोगों को अपनी डेफिशिएंसीज नहीं पता. सो विटामिन D deficiency is rampant in Pakistan. Iron deficiency is rampant in Pakistan. Calcium deficiency is rampant in Pakistan. But the testing is so expensive, people cannot get tested, right? So how do you do this? A lot of doctors then prescribe them based on the physical elements that they see. So take care of your health more. Unfortunately, a lot of people think कि हमारे खाने बहुत healthy हैं और हमारे खाने में हम खाना खा रहे हैं तो हमारी जो है ना nutritional requirements पूरी हो रही हैं. That is unfortunately not the case. A lot of people don't know this. बट जब बच्चा माँ के दूध पे होता है तो उसको आयरन डेफिशिएंसी हो जाती है क्योंकि मदर को खुद आयरन डेफिशिएंसी होती है एंड उसके साथ उसको आयरन सप्लीमेंट्स देने होते हैं बच्चे को. पीपल डोंट नो दिस, राइट? एंड द डॉक्टर्स नीड टू गाइड द पीपल बेटर. सो आई थिंक मिस इन्फॉर्मेशन पे वी डूइंग अ लॉट. We're trying to work with the governments. We're trying to work with UNICEF and the academia. I think collective effort needs to happen on misinformation. But I think if the person wants to find the right information, let's not look at the Insta reel and say, okay, this is what I need to do.
Yes,
and just talk to an HCP, just talk to a pharmacist, a trained pharmacist, and hopefully you'll get the right answer.
Pharmacists की आपने बात की, क्या trained pharmacists हैं हमारे यहाँ या छोटी छोटी दुकानों पे हर कोई तो दवा डिस्पेंस कर रहा है? किस तरह से कर रहा है? वो टेम्परेचर कंट्रोल एनवायरनमेंट में है? इस पे कोई बात होती है?
देखें, बाय लॉ हर फार्मेसी पे ट्रेन फार्मासिस्ट ही होना चाहिए. फार्मेसी खुल ही नहीं सकती, उसको लाइसेंस नहीं मिल सकता जब तक ट्रेन फार्मासिस्ट ना हो. एंड हेल्पर्स हो सकते हैं फॉर स्टॉक लोडिंग एंड स्टफ. बाकी जो कंज्यूमर को सर्व करने के लिए फार्मासिस्ट ही होगा. उसकी इम्प्लीमेंटेशन ऑफ द लॉ कुड बी क्वेश्चन. So if you go to, and it differs province wise. So some provinces do it better. So if you go to Punjab, you'll see temperature controlled environments, you'll see more pharmacists and trained pharmacists. Versus when you come in Sindh, you'll see a lack of trained pharmacists. The other basic question is that the number of outlets which are not pharmacies, registered pharmacies.
Yeah.
So Pakistan has about 55,000 registered pharmacies. But there will be about 25,000 more pharmacies or so-called pharmacies which don't have registration. So I think that's where, some crackdown needs to happen to make sure that, one, the trained pharmacist is serving the consumer. The second, the pharmacy is registered.
And the pharmacy is treating the medicine with the temperature that it requires. जिस तरह से उसको रखना चाहिए वैसे रखा जा रहा है.
एक वो बात है, दूसरी बात ये कि प्रिस्क्रिप्शन के बगैर जो प्रिस्क्रिप्शन ड्रग्स हैं, सो फॉर एग्जांपल आपकी एंटीबायोटिक्स होगी, एनी अदर प्रिस्क्रिप्शन ड्रग्स, यू कैन नॉट हैंड आउट ड्रग्स विदाउट प्रिस्क्रिप्शन.
प्रिस्क्रिप्शन की बात तो हम ना ही करें, आप कोई नारकोटिक ऑर्डर कर दें विदाउट एनी प्रिस्क्रिप्शन, उससे आपसे वो वेवर पे चेक करवाते हैं, दैट्स इट, मैं कुछ भी ऑर्डर कर सकती हूँ.
आई थिंक दैट्स अ मैसिव चेंज बिटवीन द डेवलप्ड मार्केट्स एंड वो. आप डेवलप्ड मार्केट्स में जाएंगे तो आपको ओवर द काउंटर कॉफ सिरप जो मिलेगा वो नॉन मेडिकेटेड मिलेगा. आपको पैनाडोल्स एंड ऑल ऑफ दीज थिंग्स यू विल गेट ओवर द काउंटर. बट अगर आपको कोई ड्रग चाहिए लाइक एंटीबायोटिक, यू विल नीड अ प्रिस्क्रिप्शन नो मैटर व्हाट. आप फार्मासिस्ट को बोल दें, जो मर्जी बोल दें, वो नहीं देगा. यहाँ पे दीज थिंग्स नीड टू चेंज एंड दैट्स वाई यू सी दैट हमारी जो a lot of people are talking about antibiotic resistance, that's why it's coming up. But it's not just antibiotics. You can get any medicine over the counter, and which is an unfortunate piece in Pakistan.
Yeah. Another thing that is being talked about is also counterfeit products, right? सुना यहाँ पे पूरी एक मार्केट है जहाँ पे counterfeit products बनते हैं. Is this something that you guys also talk about at Haleon, and obviously it affects your business as well?
So देखें, मैंने FMCG इंडस्ट्री में काफ़ी काम किया है, मैं फार्मा में हूँ. काउंटरफिट इज़ अ प्रॉब्लम फॉर पाकिस्तान एंड इट्स नॉट जस्ट अ फार्मा प्रॉब्लम, इट्स अ FMCG प्रॉब्लम ऑल्सो. अनफॉर्चुनेटली आर काउंटरफिट के जो लॉज हैं, इम्प्लीमेंटेशन है, इट्स ऑल्सो वेरी वीक. सो द कोऑर्डिनेशन बिटवीन द गवर्नमेंट बॉडीज़ इज़ वीक, द इम्प्लीमेंटेशन ऑफ द लॉ इज़ वीक. एट द सेम टाइम काउंटरफिट के अलावा जो एक और बड़ा प्रॉब्लम है वो ग्रे है. सो ग्रे चैनल से मेडिसिन जो आती हैं वो रजिस्टर्ड नहीं होती. यू डोंट नो इफ दे आर द रियल मेडिसिन और इफ दे आर ऑल्सो काउंटरफिट. सो यू नो अ लॉट ऑफ पीपल वांट टू बाय इंपोर्टेड मेडिसिन. आई हैव सीन बिग स्टोर्स सेलिंग प्रोडक्ट्स which are you know the expiries have been wiped. So you know we have to be very careful when we get imported products from our country in Pakistan. And you must have seen some news clippings where you know the likes of Nutella and everything was being manufactured in Pakistan.
Yes.
So you can just imagine कि you know imported के नाम पे price ज़्यादा करके चीज़ें क्या बिक रही हैं यहाँ पे. I think one of the biggest challenges that we have also, and I'm just talking about food, is our food laws are very archaic.
Yeah.
They're very archaic and the implementation is very archaic. You can see the amount of gastro cases in Pakistan. That is because of the food laws that we have. The checks and balances, the quality of the labs is really in shambles across the board. Pharma level pe, again, I think DRAP is very forward looking and DRAP is really focusing on this. There's a big work that the ministry is doing on serialization that will really help cull the counterfeit issue in Pakistan. So I have to commend here that you know in the last 2-3 years DRAP has been implementing a lot of forward looking policies.
Yeah, they've also removed the cap on non-essential products, right?
Yes.
Price cap.
I think the deregulation on non-essential is one of the reasons that जो MNCs बच गई हैं pharma में वो बच गई हैं. So, and it's very interesting. Yesterday we were in a meeting. We were talking that 20 years ago, 75% of the product lines were owned by MNCs, and 25 was local. Today, only 25% are MNCs, and the rest have left. They stayed because the deregulation helped them stay. By working on a single-digit margin does not help anyone. It is at the end of the day a business. Everyone wants to make a buck. But I think the deregulation is a good sign and a good promise for the future. It needs to evolve, and it's just been 2 years. I think we need to give it a bit more time to see how it will evolve for the future.
And have prices increased? Have companies increased their prices after this change?
देखिए, कंपनीज ने प्राइसेस इंक्रीज़ की हैं, मगर आप हमेशा याद रखेंगे कि मार्केट में कंपटीशन इतना है कि मार्केट फोर्सेस हमेशा उसको नॉर्मलाइज कर देती हैं. सो पहले 1-2 साल में प्राइसेस बढ़ी, मगर वो दे वर इन लाइन विद इन्फ्लेशन. सो इफ़ यू लुक एट द फार्मा प्राइसेस जो बढ़ी इन द फर्स्ट ईयर ऑफ रेगुलेशन, दे वर नॉट अबव इन्फ्लेशन बिकॉज इन्फ्लेशन लेवल्स वर वेरी हाई. दो दे वर 2 थिंग्स. वन वॉज इन्फ्लेशन, द अदर वॉज डीवैल्यूएशन दैट हिट अस इन द लास्ट 2-3 years. सो उसको ऑफसेट किया. आज जो आपकी इस साल की प्राइसिंग है जो फार्मा इंडस्ट्री ने ली है इज़ लोअर देन द प्री डीरेगुलेशन प्राइसिंग. सो दैट टेल्स यू कि द मार्केट फोर्सेस आर एडजस्टिंग द प्राइसिंग अकॉर्डिंगली.
सो डू यू गाइज वर्क क्लोजली विद ड्रैप, लाइक रेगुलेशन के ऊपर? डू दे टॉक टू यू गाइज, टेक योर इनपुट, या वो गैप है?
Actually, not at all. I think DRAP is very open to feedback on the policies they're implementing, on how they implement. They have very open conversations with the whole industry. So it's not just Haleon. At the same time, if we feel there's something for the industry which we can offer, that we go to DRAP. So there's a lot of work that's happening there. Just recently, we went to DRAP with the proposal of nutraceutical production in the pharma areas. So one of the key questions that was coming to the pharma industry was increasing the exports from Pakistan. Exports दो मद में होती हैं. एक pharma exports exports होती हैं और nutraceutical exports होती हैं. Pharma exports are a lot more difficult to do because you have to register your product in the importing country. And वहाँ का जो DRAP है, it takes time. It has to visit your factory. There's a lot of paperwork. It takes about 3 to 5 years to register a product in any other country.
Achha.
Nutraceutical is, on the other hand, is easier because it's considered food/nutraceutical. It can be registered in any market in 3 to 6 months. Unfortunately, in Pakistan today, you cannot produce nutraceutical in a pharma grade facility on the same machines.
Okay.
Right? Wow. So this is a conversation that we've had with DRAP and the ministry, where the US, the UK, Australia, Canada, they all allow this. They are very strict guidelines, but they allow this. And that's the proposal we're talking to them about. DRAP is very receptive. The ministry is very receptive. Because if this happens, you don't need to put in a lot of investment. Using your current machinery, you can produce nutraceutical and export. Our estimate is that anywhere between $200 to $500 million can be increased if this policy comes in the next 3 to 5 years. So this is a big export potential that we have.
And you guys have hope that it will?
We're very hopeful because the conversations are very positive. And I think DRAP is very receptive. Mustafa Kamal, the minister, is very receptive on all of these things. The conversations are going in the right direction. I think it's just about penning it down and making it work.
So I think we've always only heard about imports, right? Especially with regards to pharma and other industries as well. But I think Haleon is now working on exporting, and that I think is just beautiful, right? हम आज Independence Day के ऊपर भी बात करें. So that's great for Pakistan. You guys are producing in Jamshoro. Is that correct? And you have started exporting your product?
Jamshoro is one of the best facilities in the world. So I always say this to anyone, come to Jamshoro, go to any European facility or US facility, you'll find Jamshoro facility is at par or better than European or US counterparts. And it's state of the art. Just now, the machinery that we brought into Panadol Pakistan is the first market who's getting this technology. So that technology will be introduced later in the US and the UK.
Achha.
It's coming to Pakistan first. Pakistan has a huge potential for exports. We're already exporting to Vietnam, Philippines, and the African markets. We want to export more. And I think our commitment is that if the nutraceutical policy change comes in, we will be able to do more. Other than that, I think what we've done is we've tried to localize as much as possible. One of the biggest challenges, of course, is that API for paracetamol is still imported. And that is a big change that needs to happen in Pakistan, that, we localize APIs for the future. I think the B2B conference that happened with China just recently in Islamabad penned a lot of MOUs and engagements on localization of API. So I think the direction is right. We're going in that direction. I think one thing that is missing in the industry, which needs to happen more, is investment in R&D. That needs to happen more to really give it that shape for the future. And that's what it needs to happen. देखिए, resources बन जाते हैं, चीज़ें निकल आती हैं, but for example, the MNCs will invest a lot more in R&D, and we have consolidated R&Ds in our head offices and all of that, and those are then implemented locally. But I think the local industry also needs to collectively say, how do we invest into R&D right now for the future? And that's important.
So most MNCs are looking to leave Pakistan. A few exits have, taken place. But it's nice to see, it's heartening to see that companies like Haleon, they are reinvesting in Pakistan. Is this going to continue? Iski wajah kya hai?
देखिए, Pakistan has a bright future. Pakistan, what I say, is at the cusp of doing something great. And I think that's what a lot of MNCs were waiting for, right? So Pakistan has not hit its full potential. Yeah. If you look at our GDP per capita for the last 10 years, and if you look at the GDP per capita of the South Asian countries, Southeast Asian or South Asian countries, we've been stagnant and they've grown up. And I think everyone's just been waiting for that to change, because the consumption changes when your GDP per capita improves. And some companies left when they couldn't see that anymore. The other challenge was the devaluations that we see after every decade. And that has a big impact on the decisions that we do. Yeah. Fortunately or unfortunately, I think we still believe as a group that Pakistan has a huge potential. I think the newer generation is a lot more aware on self-care. They're a lot more aware on how to lead a healthier life. But unfortunately, Pakistan has also become it's become a tale of two Pakistans. There is a Pakistan which is 40% under poverty line. So, that Pakistan is struggling. And then there is a Pakistan who is trying to make it work, who's trying to make a hustle and improve its lifestyle. Bilkul. So I think the biggest question now is, how does the government get the poverty line reduced over time? How do we systematically bring that 40% down to 30 to 20 in the coming years? But we will continue to invest. I think the potential is there. We've seen the results. But like all other MNCs in Pakistan or looking from outside, we're also waiting for Pakistan to churn into that engine which delivers 5 to 6% GDP growth.
Yeah, and you guys are doing a lot of community work as well, right?
Yes. Communities के लिए ना again मेरी हमेशा से belief ये रहा है कि we have to actively work on improving the lives of the people of Pakistan. उसके लिए हम काफ़ी projects करते हैं. अल्लाह वाला ट्रस्ट के साथ हम बच्चों को खाना खिलाते हैं. We learn बड़ी इंटरेस्टिंग एक चीज़ उनके साथ हमने सीखी कि बच्चों को जो यूजली स्ट्रीट चिल्ड्रन होते हैं उनको खाना नहीं मिलता, वो स्कूल इसलिए नहीं जाते कि वो स्कूल जाके उनका टाइम ज़ाया होगा. तो उनने उनको स्कूल में खाना देना शुरू किया, तो बच्चों ने भी आना शुरू किया, अपने दोस्तों को भी लाना शुरू किया, अपने भाई बहनों को भी लाना शुरू किया, जिसकी वजह से मोर चिल्ड्रन स्टार्ट कमिंग टू स्कूल. सो हमने उनके साथ पार्टनरशिप की है. वी गिव फूड टू अ लॉट ऑफ चिल्ड्रन एंड मेक श्योर दे स्टे इन स्कूल. साथ हमने काफ़ी क्लेफ्ट लिप सर्जरीज कराई हैं थ्रू स्माइल ट्रेन. उसके साथ साथ देयर इज़ अ वेरी इंपॉर्टेंट प्रोजेक्ट विच इज़ वेरी क्लोज टू माई हार्ट. यूनिसेफ के साथ एक मदर मैटर्स का हमने प्रोग्राम किया इन डिस्ट्रिक्ट इन मुल्तान राजनपुर, जहाँ पे infant mortality and mother mortality was one of the highest at child birth. वहाँ पे हमने ट्रेनिंग की about 60,000 women की, and we have drastically improved the numbers in 1 year. And so those projects are very close to heart. Similarly, Jamshoro में अभी we are doing a massive investment in the area around Jamshoro on water, on medical health. So ये हम काम करते रहेंगे. But again, I think the challenge always remains is कि scale हमारा एक level तक महदूद हो जाता है. And that's where we need the government's help to really scale up these projects to make sure that these things are curtailed.
There's a lot of ambition. And I'm sure numbers back that as well. So if there's any like big numbers, because Pakistan चाहता है कि उसके पास, we have companies who work for Pakistan, who work on improving the lives of people in Pakistan. And it's always nice to see कि, बाहर की कंपनी आके इन्वेस्ट कर रही हैं, because they just want to make life better for people here, right?
I think what we are committed towards is continue to invest in the people, and continue to invest in the product lines for the future of Pakistan, and that's very important. एक चीज़ जो लोगों को नहीं समझ आती वो ये समझते हैं कि road infrastructure or these kind of infrastructures are the things that matter in an economic जो है ना growth. इकोनॉमी की ग्रोथ में हेल्थ किसी को नज़र नहीं आती है. हेल्थ के दो बड़े फैक्टर होते हैं. हेल्थ एक गवर्नमेंट को बहुत बड़ी सेविंग देती है. इफ़ यू हैव अ हेल्दियर नेशन यू विल सेव ट्रिलियंस ऑफ मनी. एंड द अदर थिंग इज योर प्रोडक्टिविटी इम्प्रूव्स, राइट? These two factors unfortunately नज़र नहीं आते. रोड आपको नज़र आती है. रोड इज़ ऑल्सो पोलिटिकली मोटिवेटेड, बिकॉज आप रैलीज़ में बोल सकते हैं हमने रोडें बनाई, मगर आप बोल नहीं सकते कि आपने हेल्दियर नेशन बनाई, राइट? एंड बिकॉज वो काउंट नहीं हो सकता. आपकी एवरेज एज कोई पूछ नहीं रहा होता आपसे पोलिटिकल रैली पे. आई थिंक द राइट conversations need to happen at the right level. We need to push the right questions and the right answers towards the people to say that health matters, and health has significant GDP impact in the population of Pakistan. There was a research by Oxford Economics. For every 1,000 rupee which is dedicated towards self-care, it generates 1,500 rupees for the economy. So it is not one-to-one. It gives you more back. And I think that's what we need to understand.
And I think what's good to hear is that pharma companies like Haleon, you're not talking about selling your products, because फार्मा कंपनीज के बारे में, लाइक आई मेंशन्ड अर्लियर, यही मशहूर है ना कि उनको सिर्फ अपना प्रोडक्ट बेचना होता है. एंड सिक पीपल आर गुड फॉर देम. द मोर इल दैट यू आर, फार्मा कंपनीज के लिए बेहतर है, बिकॉज दे कैन सेल मोर प्रोडक्ट्स. बट आप उसकी बात नहीं करना चाहते, एंड यू वांट टू टॉक अबाउट सेल्फ केयर, प्रिवेंशन, you spoke about hygiene, and these are conversations that I think would be, it's really nice to see that you guys talk about this. And pharma companies के बारे में ये भी मशहूर है that they pay doctors or they give them incentives to push their medicines. I'm assuming MNCs को ये allowed नहीं है, right?
देखिए ये किसी को भी पाकिस्तान में अलाउड नहीं है. बाय लॉ यू कैन नॉट डू दिस, बट आई थिंक MNCs पे and locally at Haleon what we believe is that ethics is above top line. So we will not do anything unethical locally or globally. And even if the local law allows it, we have our own internal bylaws to make sure that we stay away from anything grey. जहाँ तक आपने बात की सेल्फ केयर की, versus we are talking about self care. We have started this conversation on the International Self Care Day on the 24th of July. We initiated a conversation with academia, with the ministry, and we spoke about the same thing. We said it's not about the medicines that you take. It is about how can we have a healthier nation.
Yeah.
So all the people from academia, people from WHO, UNICEF, they were talking about the one same thing. We need to focus on child education, fix the future generations, have a healthier nation. I can tell you businesses will adapt and make money in other ways, right? But I think we shouldn't focus on, just making sure that our product line sells.
Yeah. And your product line, what are your top 3 products? So it's Panadol and then?
देखिए हमारे सबसे फेमस प्रोडक्ट्स पाकिस्तान में Panadol है, CAC और CAC है, and then we have Sensodyne, we have Parodontax, we have Eno, we have Centrum. So these are our famous product lines in Pakistan, and globally we have a lot more. But उसमें हमेशा मैं यही कहता हूँ कि self care is cheap. It's not expensive.
Yeah.
Self care becomes more expensive when you delay it, and that's what we need to make sure we don't do.
Yeah. And all of these products, they don't need a prescription, so they're OTC medicines.
They don't need a prescription, but I will also always suggest that you also go and talk to your HCP if you are in need. So for example, I do advise taking multivitamins daily. I take one daily. I've been doing it for the last decade, even before I joined a pharma company. But if you have a deficiency, you need to take a specific dose of, if you have a vitamin D deficiency, you need to take a specific dose. Similarly, if you have a headache, you take that Panadol tablet just to make sure it goes away. But if you have a recurring headache for a week, that means either your eyesight is off or there's something else wrong. So, then you need to talk to an HCP. You need to understand, what your body is telling you and make sure you take the right decisions accordingly. So that's very important for people to do.
You need to give time to your body. I feel like ये हम नहीं करते हैं.
देखें सबसे बड़ी जो चीज़ है ना, अगेन मैं अपनी प्रोडक्ट्स की बात नहीं कर रहा, we don't walk as a population.
Yeah.
We don't walk anywhere. We don't have places to walk also, right? And that's unfortunately one of the biggest part. Our sedentary lifestyle is one of the major problems. Our major problem comes from the lifestyle that we have, the food that we eat, and the water that we intake. If these 3 things can get fixed, then we will have a healthier population to start with.
Yeah. So in self-care, you spoke about water, hygiene. Oral health के बारे में कम बात होती है. Except कि बस दांत 2 दफ़ा ब्रश करें, that's it, right?
ये आपने बड़ा अच्छा सवाल किया है, and अनफॉर्चुनेटली मैं एक रिसर्च पढ़ रहा था पाकिस्तान के ऊपर. सो आपको अच्छा नहीं लगा ये सुन के कि पाकिस्तान में अभी भी 50% लोग सिर्फ दिन में एक बार ब्रश करते हैं. एंड हमारे यहाँ डेंटिस्ट विजिट तब होती है जब जो है कैविटी लग चुकी होती है, दांत का बुरा हाल हो चुका होता है. आई थिंक जिस तरह आप अपनी बॉडी का ख्याल रखते हैं, दांत इज़ वेरी इंपॉर्टेंट. द चैलेंजिंग पार्ट अबाउट द दांत इज़ कि एक बार दांत ख़राब हो जाए तो वो निकल जाए, वो रिप्लेस करना वो दोबारा नहीं हो सकता. एंड इट्स डन एंड यू ओनली हैव 32 teeth to manage. I think brushing twice a day is the easiest way to manage your oral health, and that's the basics of it. दूसरी चीज़ a lot of people don't understand कि जब उनको sensitivity या हसासियत होती है, लोग ठंडा खाना छोड़ देते हैं या गर्म खाना छोड़ देते हैं, वो रूट कॉज पे नहीं जाते. बेसिक आपके जो पहला लाइन ऑफ डिफेंस है इज़ अ प्रोडक्ट लाइक सेंसोडाइन, या अगर आपके गम्स ब्लीड करें तो आप पैराडोंटेक्स यूज़ करें. वो करते रहते हैं कि यार चलो ठीक है, आई लीव चाय, आई लीव आइसक्रीम, और चलती रहेगी. व्हाट दे डोंट अंडरस्टैंड इज कि पीछे को रूट कॉज चीज़ें चेंज हो रही हैं. सो बेसिक लेवल पे इफ़ यू यूज़ प्रोडक्ट्स लाइक सेंसोडाइन एंड पैराडोंटिक्स, यू ट्रीट देम एट द फर्स्ट लेवल. इफ इट कंटिन्यूज टू गेट वर्स, देन गो टू अ डेंटिस्ट. बट गो टू अ डेंटिस्ट बिफोर इट कम्स टू एन एंड वेयर आपका दांत निकालना पड़ जाए. एंड आई थिंक दैट्स वन ऑफ द बिगेस्ट थिंग्स. आई थिंक ओरल हाइजीन पे अगेन वही वाली बात आती है कि आर वी एजुकेटिंग आवर चिल्ड्रन इनफ? Are we in the masses educated the people enough to make sure that oral hygiene maintain ho? And that is the biggest challenge that we do. And just like any other thing, oral hygiene is one of the most important things, because आपको भी पता होगा जब दांत का दर्द होता है तो the body stops functioning.
Yes. Yeah, it's bad.
Yeah.
It's really bad. Before we end this, I want to talk a little about your journey. So from Unilever, Nestle to L'Oreal to a pharma company, big jump.
No, absolutely. And I love the jump. And I think one of the reasons a lot of people ask me is, why are you still in Pakistan? And I say this with a lot of pride that I have a dream that I will change Pakistan for the better somehow, whatever I do. And I think coming into a self-care company for me was towards that ambition, that how can I change Pakistan for the better? How can I play my part in improving Pakistan? Because I also believe that, we can complain a lot about Pakistan, but, what are we doing to change it? And I think that's my motivation to be in a pharma and a self-care company and in Haleon, because I believe Haleon has the tools to change Pakistan for the better. And I'm here to stay, and hopefully I'm able to fulfill my dream.
And would you like to give a message? Because एक बहुत खास दिन है, 79th Independence Day as well, right?
देखें, 79th होगा, eventually 90th होगा, eventually someone will replace me on this seat and someone will replace you on that seat. And I think my only advice is, please take care of your health before you have to go to the doctor. Take your precautions, educate your children, educate the future generations. The biggest gift that you can give them is one, education. The second is a healthier lifestyle. Your children might not even thank you for that when they grow up, but you will know that they will lead a better lifestyle if you do that. That is my only message. Please take care of these two things. And inshallah, we'll have a healthier Pakistan for the future.
As a professional, you're an IBA grad, you've been working for how many years?
20 years now.
20 years. What would you like to say to the generation that's coming out now?
For the generation that's coming out now, one of the biggest changes is that the work environment is changing. The work environment is no more going to be 9 to 5. There are a lot more opportunities which are beyond this. And I think what I loved about the new generation is that they are hustlers. They are hustlers. They don't take anything standing down. They stand up for their rights. And I love the Gen Z and the new generation Alpha that's coming through. They know what to do. So continue to hustle, continue to work hard, and continue to break boundaries. I think what we couldn't do and our generations before us couldn't do, you have to do for Pakistan. And it is in your hands to make sure that you push Pakistan towards the right direction.
Yeah, definitely. Absolutely agreed with that. I think this generation is going to bring us a lot of happiness. I think things that we couldn't do.
Absolutely.
Thank you so much for joining us. बहुत अच्छी हमने आज conversation की, and I'm so glad that it was not branded and it was not only about selling your products, but it was about a larger mission of self-care. And I think that is so important, जो उन्होंने आज message दिया for Pakistan, that it's important कि हम prevention की तरफ काम करें, hygiene की तरफ काम करें, self-care की तरफ काम करें, कि हम इन बीमारियों से दूर रहें और हमें इस मुसीबत में पड़ना ही ना पड़े. So I think it's important, guys. Take care of yourself, take care of your body, work out, eat healthy, and live a good lifestyle. A healthier nation will build a healthy Pakistan, जो बहुत ज़रूरी है for any economic growth. अपना बहुत ख्याल रखिएगा. खुदा हाफिज़.